Hello, everybody. My name is Muhammad Adil Raja, and I'm from the Regulated Software Research Center that is based in the Dundalk Institute of Technology in Dundalk, County Louth, the Republic of Ireland. I'll be presenting on behalf of myself as well as my co-authors, who are Dr. Roisin Logran and Professor Fergal McCaffrey. The title of my presentation today is about our paper that was selected for publication in the Irish Signal Systems Conference 2024 that is titled as Cholecystectomy Surgical Instrument Detection Using Variants of YOLOv8. So basically the idea in this presentation is to apply object detection algorithms that are based on the YOLOv8 algorithm for object detection for computer-aided varoscopy instrument tool detection. So here is a brief overview of our presentation. First of all, I'm going to give a small introduction to what I'm be talking about, and then I'll give a small introduction to computer-aided paroscopy. After that, I'll talk about a little bit about object detection and the YOLO algorithm. Then I'll present the experimental details of our research, and then I'm going to present the result, and eventually I'm going to conclude my talk. So, surgery is a delicate art that requires precision and patience. So, it is a centuries old art in which surgeons have to be very careful in performing surgical procedures on sick or ill human beings which have such ailments that can only be corrected or improved by surgery. In recent years, robotic apparatus has also come to the rescue of surgeons, by the help of which they can perform surgeries over human beings. And the good thing about this is that this can also be done remotely. So, to this end, if a patient is lying in a operation room in the United States of America somewhere, and the surgeon is somewhere in Europe, they can, by using the robotic apparatus and communication technologies of our times, they can successfully perform robotic uh, procedures. And the famous robotic apparatus tools nowadays are the Zeus operating system as well as the Da Vinci robotic apparatus for performing robotic surgeries. So one of the things is that the machine learning community has to inevitably improve their object detection algorithms. So this is an ongoing quest in which engineers and scientists try to improve their algorithms, and the initial thing, the initial ambition is to improve the accuracy of the algorithm, and then once that has been achieved, they try to improve the real-time efficiency of the algorithm. This is true about all machine learning algorithms, and object detection is not an exception. Object detection, in turn, has also become more accurate and faster due to these endeavors over the past few years. And this has also paved the way for inclusion of object detection models for robotic apparatus to the rescue of the surgeons, or to help the surgeons perform surgeries in a better way. So, what is computer-aided paroscopy? So, computer-aided paroscopy is in which a small incision is made to the body of the patient under operation, and a laparoscopic apparatus is inserted, including camera probes as well as surgical tools inside the body of the patient, and with the help of that, the surgeon performs the surgery. The good thing about this is that instead of opening up the whole body, small incisions can be made, and because of that, it requires smaller surgery times, less blood flow, as well as small incisions, and with the help of the robotics apparatus, lesser complications. The possibility of lesser complications is over there. So, CAL technologies can help alleviate some of the burden on surgeons. So, all the robotics will never completely replace humans ever. However, the robotic apparatus can be used with a human in the loop approach, in which the robotic apparatus can be used to assist the human beings to perform surgeries more accurately and more delicately. CAL can enormously affect the efficiency of surgical operations. One of the important domains is CAL's is computer vision. And in computer vision, object detection based on computer vision has tremendously helped to achieve sophistication in computer-aided pyroscopy, and this is owed to advancements in high performance computing as well as machine learning algorithms. So advancements in convolutional neural networks and graphical as machine learning algorithms and graphical processing units as high performance computing hardware have resulted in the ability to tag surgical tools in real time accurately. So, object detection is the task of identifying objects in images and tagging them with appropriate labels. So, classically, computer vision is done by using a classification approach in which an image is presented to a model, and the model basically tells us that what kind of objects are present in the image. However, in object detection, the model additionally also tells us the exact location of the images of the objects in the image by drawing bounding boxes around them. So it basically localizes objects in images, and this is useful for various actually too many applications, including cal tool detection as well. So object detection is quite different from mere classification models. So object detection came, algorithms for object detection have been developed since over the past decade, and one of the recent algorithms was the YOLO algorithm, which YOLO stands for You Only Look Once, and the YOLO is different than the previous object detection algorithms in the sense that it passes the data only once through the model to do both classification of the objects in the image as well as also localizing the images, objects in the image as well. So it poses the problem, as opposed to posing it as a classification problem, it formulates the problem as a regression problem in which regression between the bounding box coordinates of the target image is performed vis-a-vis the bounding box coordinates predicted by the model. YOLO has come a long way since its inception a few years back and has seen so many versions up till now, and each one of them has improved tremendously over the past, both in terms of prediction accuracy as well as computational efficiency. The current version that is available online is known as YOLO version 8. It has 5 variants depending on the size of the model, which are N, S, M, L, and X, which stand for nano, small, medium, large, and extra large, respectively. So our experimental details are that we employed the well-known M2CI tool locations dataset in our research. This is a dataset, open source dataset that is annotated very well for cal tool detection, and this dataset contains special tool annotations for 2,811 frames involving 10 videos. The dataset consists of 3,141 annotations of 7 classes of surgical instruments: grasper, bipolar, hook, scissors, clippers, irrigator, and specimen bag, respectively. This image basically shows, the top row shows various kind of instruments that are present in the dataset, and the bottom row shows how they could be tagged by a model or how they are annotated, and these bounding boxes basically show are drawn around them to make them amenable for tagging. So there is an average of 1.2 labels per frame. The dataset is divided into 1405, 843, and 563 instances for training, validation during training, and testing on unseen data, respectively. This roughly forms splits of 50%, 30%, 20% of the whole data, respectively. And this data set has been used just like this for various benchmarking studies for cal tool detection. This table basically shows us the distribution of the data in terms of various instruments. So these are the results. I'd like to show you the confluent matrix. So confluent matrix is a very valuable tool for assaying the efficiency of accuracy of a classification model. So over here, on the y-axis we have the true classes of the data, and on the x-axis we have the predicted classes of the data, and these every block tells us about as to what the true class was predicted as. For instance, and the diagonal entries show us the true what percentage of the data was predicted accurately. So over here, for instance, it shows that 85% of the grasper instances were predicted accurately as grasper, and over here it shows that 91% of the scissors were predicted accurately as scissors, whereas 5% of the scissors were misclassified as clippers. So this is a good thing about the computer metrics, that it also tells us that what exactly was a particular tool or a particular object or a particular class misclassified as. And it tells us over here that 1% of the scissors were misclassified as irrigators. So this is a good tool, and or the bluer or it is over here on the diagonal entries, the more accurate the model is. So this is the configuration matrix for the small class, and this one is for the small model, and this one is for the medium model, and similarly this is for the large, and this is for the extra large model. And we see over here that the accuracy of the model is higher for both the large and the extra large models as opposed to the previous ones, which are over here. Yeah. So these images basically tell us about the results of the inference. So over here, these are the images, and these are the bounding boxes drawn by the inference models, and they are for different tools. For instance, this is for the grasper, this is for hook, and so on and so forth, and these are for different batches of the data, just for a pictorial outlook. And each of the bounding box for different tools, the bounding boxes have been assigned different colors. For instance, grasper has the color green, bipolar has pink, hook has dark orange, and so on and so forth. These results basically give us confidence curves for various metrics. For instance, this is for the F1 score, the confidence curve for that. This is for the this is for precision, and this one is for recall, and this is the precision recall curve. The higher it is towards this edge, it means the better the model is, and this is for telling us that. These are the performance of YOLOv8X on the unseen test data, and this is telling us about different performance metrics. For instance, precision recall, mean average precision, for all the tools respectively. So this is good in the sense that we can know that how the model performed in predicting each of the tools especially, and what badly it did for some of the tools. So this is a good way. Comparison of different models in terms of mean average precision is also given over here. So in this column we have all the tools, and over here we have all the models from N to X, and this is basically telling us that the large model on average did better than all the rest of them, whereas in certain instances the extra large model performed better than the large model as well. This is basically telling us about the inference speed. For instance, the nano model had the best inference speed, as well as the extra large model had the worst one, which makes sense as well because the extra large model was bigger in size, so it is 10 times slower at inference than in the nano model. So these are our conclusions. So we compose results related to the tool detection CAL instruments, and we use the well-known M2CA tool location dataset, which has been used in various benchmark studies to validate the results. Our overall results were good, and they are useful for both the object detection model development community, as well as CAL tool detection community as well. And this work is part of a wider research agenda that is ongoing in RSRC in the moment, and we are hopeful that we'll be doing more exciting work in the future as well. So I thank you all very much for your patience, and if you have any questions, please feel free to ask them. Thanks, Reed.